Now, if you have what we call carpal tunnel syndrome, where you're having numbness in your hand, okay, especially the thumb and index finger, and you're losing control, the coordination and the strength in your hand, that means you have a pinched nerve going down to your hand. So that problem can be coming from the wrist, but I can tell you from my practice, that a lot of people who's been diagnosed with carpal tunnel syndrome do not just have problem with the wrist. In fact, the majority of them have problem with the neck. So if you have any problem with your hand, like numbness, loss of power, loss of coordination and strength, make sure you treat your neck. That's the most important area, more important than your wrist. Okay. Now you could treat your wrist, but I've found many people in my practice, many of my patients, I just look after the neck and we restore the function there, and the hand and wrist works fine after that. Okay. So to treat the wrist, if you have pain from arthritis or chronic sprain, or if you have fractured your wrist from a fall, you're getting a lot of scarring and restriction movement, then this treatment is very good. So to treat the wrist, okay, we just use the 2 large pads. Now the important thing here to remember is because the pads are pretty big, we don't want the pads to be touching against each other. If the pads make contact against each other, then the current will go between the pads instead of going through your body. So it will not work in that sense. So make sure the pads are not touching each other. Now anytime you're treating any area, make sure that body part is nice and relaxed, okay? So that you're not, you don't have to flex your muscle. Let it relax, put it in a neutral position. So I always use a cushion here and just stimulate it. Now go slow here because there is a nerve here called the median nerve that runs through your wrist, okay, between the 2 tendons, and it's very sensitive. So you're going to feel stimulation going right down into your fingers. Okay, I just go slow. There it is, okay? So you're going to feel the muscle contracting and feel the sensation, the circulation going to your fingers. And it's a very nice feeling as long as you go slowly with the device and turning up the intensity. Just like that, okay? So 1 pad on each side, and you can see my hand, is contracting because the muscles is working and the nerve is being stimulated. And that's what you do, okay? 20 minutes at a time, 3-4 times a day until you feel better. Now, if you have arthritis in your fingers, okay, any of your fingers, from osteoarthritis, if you have rheumatoid arthritis, that's very nasty, all swollen up and loss of mobility, okay? If you don't use this, that's great, because I've seen many patients who use this and they've been able to reduce the anti-inflammatory and the painkillers they have to take, which is very hard on your body. So you can use this to reduce your meds, or some of my patients actually don't need meds anymore. But before you change any of your medication intake, consult your own physician, please. All right? So to treat any of the fingers, you just sandwich. Very simple. Just sandwich your joints with the pads, okay? If you play ball, sports, and you sprain your fingers, just do this all day long. That's the best way to stimulate the circulation and the self-healing, okay? Just like that, all right? By doing this, I'm going to reduce the inflammation, reduce the pain. Now, if you have arthritis anywhere in your body, go to our website too, because we have a lot of good supplements that are very good for, joint inflammation or cartilage problems. Just like that, all right? Best wishes to you. If you have elbow pain right here, then you need to stretch out this group of extensor muscles. To do that, just grab your palm, pull your wrist towards you while you're straightening out the elbow, just like this. Okay? You can hold it for a few seconds and repeat it about 10 times, just like that. All right? Now, if you have pain on the inside of your elbow, right here, then you need to stretch out the flexor group of muscle. And to do that, you have your palm face away from you. And again, I'm pulling the wrist, so I'm pulling the hand towards me while I'm straightening out the elbow. I can hold it for a few seconds to give it some more stretching and repeat about 10 times or whenever you feel you need to. All right? This is important for anyone who do a lot of computer work if you do a lot of heavy labor work with your hand or gripping action, then those muscles can tense up. Or if you play certain racket sports, again, they can give you trouble. So do those exercises regularly can help to maintain the length of those muscles so it doesn't pull on this, so the attachment of the tendon doesn't pull on the bone, so you stop getting those problems coming back. Now, if you have a wrist problem, okay, if you had a fracture before, you got some arthritis in there, and you lack motion in that wrist, the best thing to do is to flap that wrist loosely, okay, just like that. In fact, let the arm down all the way, okay, and just flap it whenever you have a chance, okay. Just do that as often as you can throughout the day, and that can help to restore the motion in that wrist joint. Now, if you have trouble turning your forearm, okay, there's two bones here and they cross over each other, and sometime after a fracture with the casting effect, you get a lot of scar tissue, so you cannot turn your hand. Well, don't give up. Just repeat, okay? Lots of repetition. Just turn and give it a little snap at the end, like try to use some momentum to get motion. So again, let the arm go loose completely. Just turn, 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 turn. So whichever direction you have restriction, and usually it's going out, then I would do that repeatedly throughout the day, and that will help you restore the motion that you have lost. Now, for any finger joints that you may have arthritis or other problem that cause loss of movement, then throughout the day, again, you can just slowly traction those joints, just like that. So whichever joint gives you trouble, just pull on it and move it passively, just like that. Okay, and take it to the range of motion and just gently stretch it, each joint just like that. Okay, so again, any joint you have problem, just move it. There's an old saying, motion is lotion. So when you move a joint that's stiff, you can help to lubricate the joint so that you can restore some of the motion you have lost, and also to maintain what you have. I mean, maintaining good range of motion throughout the body is very important to stay active and to stay healthy. Now, if you have pain in your elbow right here, okay, what we call lateral epicondylitis, okay, you're probably doing some heavy work with gripping, or you actually play some sports, or you could have a circulatory problem or pinched nerve problem from your neck that supply this muscle group. Now, to treat this, okay, what we're going to do is we use the large flex tone pads, and we're going to place one right over the painful area, and then the second one, we're going to just place it below. Our goal here is to relax what we call the extensor muscle of the forearm, and to reduce the pain here, and to reduce the inflammation, to stimulate the circulation overall, to allow the body to heal itself. All right? So if I stimulate my muscle this way, it's going to speed up recovery. Now, before we do that, anytime you stimulate any body parts, that body part should be fully relaxed in a neutral position. You don't want to be holding your arm up while you stimulate, because now you're fighting against the machine, and that's not good. So get a cushion, okay, make sure your arm's nice and relaxed. We just turn it on. All right, and doesn't matter which mode you use, but you want to have it high enough, the intensity high enough that you actually get some muscle contraction and relaxation. All right, so I also suggest you trying to rest the arm and not to do the repetitive motion as much, so they have a chance to heal properly. And also, you should try treating your neck. If this is an ongoing problem that you had for years and years, and not a recent injury from just doing something external, that's too straining for your body, you definitely should be treating your neck. You just go to the section on DVD where I teach you how to treat neck and headache, and you'll learn how to treat the neck, because I've seen in my practice many times people who get pain here and they don't even do hard work. Okay, they get numbness and weird sensation in the arm, or they get what we call carpal tunnel syndrome, where their hands go numb and they lose control. It all comes from the neck. So do not ignore the neck. This is where the blood and nerve starts, and it circulates down your arm. And you need the blood and the nerve to circulate 100% in order for your body to function right so that it can repair itself. So if you don't treat here, then it's very hard to get 100% result by treating the painful area alone. Okay, so just to remind you of that. Now, if you have pain on the other side of the elbow, right here, okay, actually here we call it, tennis elbow, whether you play tennis or not. And on this side we call golfer's elbow, okay, again, whether you play golf or not. So here we do the same thing, except now we put the pads over this painful part of the area and on this part of the muscle group, the flexor group. And this is also very good for anybody who get that numbness and tingling down their arm into the fingers, the carpal tunnel syndrome group. So we just turn that on. And here, just turn up slowly because there is a nerve that runs through here and here. So it's quite a sensitive area. So just go slow. In fact, anytime using the machine, turn up slowly because a lot of you might misjudge my machine by its size. You go, wow, so small. I'm not going to worry about, it having too much power. But I can tell you, this is one of the most effective and most powerful device on the market today anywhere, all right? So just like that, okay, make sure your arms relax. Just let it do its work, okay? Let it relax the muscle, stimulate the circulation, and then your body will heal on its own. If you have elbow pain right here, then you need to stretch out this group of extensor muscles. To do that, just grab your palm, pull your wrist towards you while you're straightening out the elbow, just like this. Okay? You can hold it for a few seconds and repeat it about 10 times, just like that. All right? Now, if you have pain on the inside of your elbow, right here, then you need to stretch out the flexor group of muscle. And to do that, you have your palm face away from you. And again, I'm pulling the wrist, so I'm pulling the hand towards me while I'm straightening out the elbow. I can hold it for a few seconds to give it some more stretching and repeat about 10 times or whenever you feel you need to. All right? This is important for anyone who do a lot of computer work. If you do a lot of heavy labor work with your hand or gripping action, then those muscles can tense up. Or if you play certain racket sports, again, they can give you trouble. So do those exercises regularly can help to maintain the length of those muscles so it doesn't pull on this, so the attachment of the tendon doesn't pull on the bone, so you stop getting those problems coming back. Now, if you have a wrist problem, okay, if you had a fracture before, you got some arthritis in there, and you lack motion in that wrist, the best thing to do is to flap that wrist loosely, okay, just like that. In fact, let the arm down all the way, okay, and just flap it whenever you have a chance, okay? Just do that as often as you can throughout the day, and that can help to restore the motion in that wrist joint. Now, if you have trouble turning your forearm, okay, there's two bones here, and they cross over each other, and sometime after a fracture with the casting effect, you get a lot of scar tissue, so you cannot turn your hand. Well, don't give up. Just repeat, okay? Lots of repetition. Just turn and give it a little snap at the end, like try to use some momentum to get motion. So again, let the arm go loose completely. Just turn, 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 turn. So whichever direction you have restriction, and usually it's going out, then I would do that repeatedly throughout the day, and that will help you restore the motion that you have lost. Now, for any finger joints that you may have arthritis or other problem that cause loss of movement, then throughout the day, again, you can just slowly traction those joints, just like that. So whichever joint gives you trouble, just pull on it and move it passively, just like that. Okay, and take it to the range of motion and just gently stretch it, each joint just like that. Okay, so again, any joint you have problem, just move it. There's an old saying, motion is lotion. So when you move a joint that's stiff, you can help to lubricate the joint so that you can restore some of the motion you have lost and also to maintain what you have. I mean, maintaining good range of motion throughout the body is very important to stay active and to stay healthy. Now, if you have shoulder pain from tendonitis, bursitis, or arthritis, you should be doing this treatment. Use the large Flextone pads in 2 areas to start with. We'll put one in front and then one in the back of the shoulder. All right? And we just turn it on. And it doesn't really matter which mode you use. I personally like mode A and B, the best for this area. And the key here is you want the arm to be fully relaxed. In fact, when you're treating any body parts, you should be fully relaxed in a neutral position. You don't want to fight against the machine, all right? You want it to be nice and relaxed so the pain therapy stimulation can help to work the knots out, to reduce the inflammation, to stimulate circulation, okay? You can only do that if you're nice and relaxed. So I usually like to get a cushion and rest my arm like this so that the shoulder can be totally relaxed when I'm doing this treatment. Now, you see the muscle moving, and that feels really nice, okay? It feels like the knot inside is getting worked out. If any pain inside, it's going to help to, reduce the pain, improve the circulation, reduce the inflammation, and more importantly, help to break up any scar tissue that you may have developed. So some of you may have trouble, raising your arm, like what we call frozen shoulder problems. Then you got to do this to break up the scar tissue. Now, if you have a chronic problem in your shoulder, elbow, wrist, hand, like numbness and loss of sensation in your arm, and using the stimulation in those areas alone may not be enough. You also need to stimulate and treat your neck with my pain therapy system, because if there's problem with your neck, you may not have neck pain, but it can cause entrapment or pinching of the nerve that starts from your neck, that runs through your shoulder and through your arm to your fingers. So in order for you to get the best results, for any chronic problem, I suggest you also treat your neck, which I'll show you in the next segment, okay? And also the local area where you're having pain. Now, let me continue with the rotator cuff area here, okay? So after 20 minutes with the pads in front and behind, I usually like to stimulate another set of points. Now, a lot of the points I'm showing you are related to the acupressure or acupuncture points, which I learned, from my studies. And by stimulating the nerve and the points, we're going to get really good results. Combined with the new technology we have, okay, inside our pain therapy system, and if you're using it now, okay, there's many, many different types of treatment programmed to this device. And because it's constantly changing, okay, our proprietary technology allow your body to get better faster because it will not adapt to it. And that's why, you get such great results even after 20 minutes of use, okay? Now, with any injury that are chronic or acute, do not be afraid to use it, frequently, okay? You can use this 3, 4, 5 times a day. Whenever you have a chance to sit down and relax, just do it, okay? Because that'll speed up your recovery. I know before my practice, people can only come to my practice, to see me maybe 3 times a week maximum. And they don't heal very fast because they're not getting enough treatment. Well, with this home therapy device that's portable, you can get as many treatment as you need and whenever you need it. And that's why, this is getting such incredible response with so many people with different problems. So do that and you'll get better faster. Now, here's a good exercise for your shoulders. If you have bursitis, tendinitis, arthritis in your shoulder joint, or if you have trouble lifting your arm up all the way, then you should try this exercise. It can help to just break up some of the scar tissues inside to increase the range of motion. So first thing you do is just hold your arm up as high as you can, okay? Make a fist and whip the arm down as fast as you can and then let it go completely loose so that the momentum brings the arm back up. So whip it down fast and let the momentum bring it back up. So like this. Now you don't have to stop at the top. I'm just stopping so you can see. You can do it continuously. Come down fast, let the momentum bring it back up. Now, do not use your muscle to lift it because you won't be able to, okay? It's the momentum that brings it up, and then that breaks up some of the scar tissue. So let me show you again. So bring it down hard and fast and let it go completely loose and let it go around. Okay, so do about 10 times in one direction and repeat in the opposite direction. Again, I start with the arm up as high as I can. I'm going to bring it down hard, let it go loose, let the momentum carry around. So here we go. Okay, just like that. And you'll find it'll start to get more loose each day as you do this, all right? Keep doing it until you get your full range of motion back. Now here's some other stretching exercises you can do for your shoulder, okay? One is, if you want to stretch the back of the shoulder, just bring your arm out, anchor with the other arm, and just pull, okay? You should be feeling the stretching back here. Now once you feel the pull, you can rotate your body slightly to get additional stretch, just like that, okay? Now you can hold for 10 seconds, or you can just gently tug on it to get that stretching effect. All right? Another stretch is just bring your arm up, bend at the elbow, and grab the elbow with the other hand and pull down till you feel the stretching happening in this area. Okay? And to get additional stretch, just bend this way, and then now you can feel it stretching all the way down to the side of your body as well. So that's a nice stretch. And if you want additional stretching, just rotate it this way. Okay? Now some of you may have trouble turning your arm. So we want to increase the range of motion there. So to do that, bring your arm out, turn your palm up, and go back. And then when you come back in, turn your palm down, and go across. So now bring it all the way back till you feel the stretching action in the shoulder and in part of the chest muscle. So palm up on the way back, palm down on the way back. Okay, so those are the basic stretching exercises you can do for your shoulder. I suggest you do each exercise about 10 repetitions each time, and just repeat it throughout the day, 2-3 times a day, or as you feel you need it. The key is to do it every day, because that way you can restore any movement that you have lost and also maintain any good movement that you do have, and then you can stay healthy all the time.